I'm Megan Miller. I own Megan Miller Direct Primary Care, where we are here today, and I'm a family nurse practitioner. I have been a family nurse practitioner since 2016. I started my nursing career as an emergency room nurse, where it's high adrenaline. You don't know what's going to come through the door. It's very stressful, and I loved that for a long time, but I knew that I wanted to continue my career in the provider realm, and I wanted to make decisions and have autonomy, so that's why I went to nurse practitioner school. So I did that, and I wanted to continue with that high stress life for a little bit, and so I did inpatient neurology work. And as I was doing that, I realized that we really lack in quality primary care in not only my community, but really like in our country right now. Patients don't get the primary care that they deserve, and so through some career searching, soul searching, and model searching, I found the direct primary care model. And so now I have Megan Miller Direct Primary Care. And I really believe that I'm changing patients' lives because we're taking a deeper dive. We're looking at just beyond writing prescriptions or just beyond basic 15-minute appointments and complaints, and we're talking about mental health, and we're talking about adrenal health and gut health and hormones and, you know, driving forces for inflammation and chronic disease. So, you know, this model is specialized for each patient. I have a relationship with each patient. We take a deeper dive, but thanks to Industry Lab, specifically this year, we've been able to take that up a notch and get even more specialized care to my patients, and they deserve that, and I'm thrilled to have Industry Lab a part of my practice. It's so interesting. You open a practice and you have no clue what lab you're going to use or what resources there are. And so having Industry Lab, a couple things, they're hugely reliable. So the system is so easy to order the test that I want, the diagnostic testing, and the pickup is seamless, which is super exciting, because the one thing that I don't want to do every single day is, oh, we got to dial in the labs and we have to make sure they come, and then if they don't get picked up, then the patient doesn't get results. So Industry Lab has done a really good job of making that seamless. So I'm super appreciative of that. But most importantly, the diagnostic tests that we're running are so important for each patient because of the genetic PCR component, but also the array of pathogens that we're testing for make my job so much easier, because I am passionate about not overprescribing antibiotics and preserving gut health and your gut microbiome. And so these tests that I can order help me specialize that game plan so I'm not harming the patient in any other way, and I'm treating for exactly what is being found and not just fishing in a large pond with a question mark. I think that one of the best examples that I can give is definitely with the urinary studies. You know, we have females constantly thinking they have urinary tract infections. This is a common theme across emergency rooms, primary care offices, urology offices, etc. But really, it's not always a urinary tract infection. And so, again, that array of pathogens that we can test for and actually make a diagnosis in less than 24 hours, that's proper care. That is gold standard. So that's hugely important for me and for the patient. And again, we're just not prescribing random antibiotics, systemic treatment that it can be more harmful than good. I'm treating exactly what their body wants me to treat with, which is super exciting. And we're seeing great results. People are feeling better. We're not needing repetitive tests, so I'm super thrilled with that for sure.